Hi, my name is Chrissy Gaines, and today I'm going to go over the process of how to teach a patient to take their radial pulse. During this video, I will state two learning objectives that I want the patient to meet, and then I will also go over the patient education process. The first phase in the patient education process is the planning phase, and the assessment phase. And during this phase, I will just assess the patient's health literacy and their capability to learn. The next phase in the education process is the planning phase, and this is the phase in which I will collaborate with the patient and we will determine those objectives that we want them to meet. The next phase after that is the implementation phase, and this is the actual patient education process. I determined that my patient is a visual learner, so I will teach her by demonstrating it myself. The next phase after the implementation phase is the evaluation phase, and this is the phase in which I will just measure the outcomes to see if the objectives were effective and if the patient was able to take her radial pulse. The two learning objectives that I want my patient to meet is one, the client will be able to determine the landmarks needed to take a radial pulse, and then two, the client will be able to correctly take a radial pulse for 1 full minute before discharge. Okay, so let's go ahead and get started. This is my patient, Caitlin Troutline. Hi, Caitlin. My name is Chrissy Gaines. I'm your nurse today. The doctor prescribed you to take a beta blocker. So the reasons that you were needed to be able to count your radial pulse is that medication has some effects on your heart rate, and the doctor would like you to take a radial pulse every time before you take this beta blocker at home. Okay, are you ready to get started?
Yes.
Okay, so to be able to effectively meet the first outcome, I need you to be able to state the landmarks needed to take a radial pulse. And the landmark is on this side of your hand, and then you'll go to your radial pulse is always located on your thumb side of your hand, and then it's right in between this groove in your wrist. You'll have to palpate it there. Sometimes it can be tricky to find.
Okay.
Once you're able to find it, you've got it.
Mm-hmm.
Okay, so go ahead and you'll start counting your pulse for 1 full minute whenever I tell you to start, okay? You'll need a watch every time you do this to be able to count your heart rate for 1 full minute. Okay, go ahead and start counting. Okay, that's 60 seconds.
60.
And you got exactly 60. Okay, so now I'm just going to go over this, and I'm going to count it myself to evaluate whether or not you were able to correctly take the radial pulse, okay? I'm going to find the landmark, which is right here. Okay, and I've got a pulse. So now I just count every single beat that I feel once I'm palpating, and I count it for 1 full minute. I was able to locate your pulse, and I counted it for a full 60 seconds, and I actually got 62 beats per minute. That's okay that we were off just in the slightest bit. Um, so you were effective in counting your radial pulse and in determining the landmarks to locate your radial pulse. So thank you.